I think it's very important to involve patients in the decision about the management of the disease and to inform them properly about all the potential options and the pros and cons of the different options. And then eventually, in my view, it is the patient that decides. Because it's the patient that has the disease, not me. So I want the patient to be the one who eventually chooses. But to be able to make a good choice, you really need a lot of proper information. And that's an issue in our daily clinics. How do we convey all that available information in a digestible way to a patient? I really try to, on one hand, already ask a lot of questions to the patient before they actually come into the clinic, so that we are fully aware of most of the things they can already tell us and not waste time during the visit to actually ask, how are you, is your nose blocked, can you smell, that sort of things. So we do all that in advance, but you cannot really give a lot of dedicated information to a patient as long as you don't have a diagnosis. So normally it is try to collect as much information as you can before, then discuss with the patient the different options. Say you don't have to choose now, then give all the available information. And I really always encourage my patients to record the visits so that they can, especially if they're on their own, that they can, when they are home and the partner says, hey, what did the doctor say? Well, this is what the doctor said. Because even if I go to the doctor, when I'm outside, half has been forgotten or rephrased in a way that's inappropriate. So I'm sure it will be the same with my patients. So that's the way I try to come to really shared decision making. But it all depends on the quality of the information you can give to the patient before. I'm very hopeful for the future. Until quite recently, we worked like trial and error. Let's try this. Oh, 6 months later, it doesn't work. Okay, let's try something else, etc. Now, with all the possibilities of endotyping, of understanding the basic inflammation as underlying cause of the disease, that really points us much better to the most likely best. And we're not there yet that we can say, well, you know, this is number one for you and it will never change. But at least it's not 6 options, but only 2. And that's already a massive improvement, and it will become better in the next years.